Napesión de Mokemana, Yomokonzame Sayayango, Naelikan Hangara Pesio, Zamsale Langa, Sale Langa.
Hello Africa, hello Nigeria and Taraba, and welcome to Franklin Live International. This is Taraba Television. My name is Franklin Fabulous Felixson. Well, you know, today is the 8th day in the month of October 2020. And of course, we're interested in the theme Hope in Sight. Interestingly, this day marks the International Day of Sight. And you agree with me that about 1 billion of people worldwide are suffering from the infirmity of sight. And so this suggests to us also that out of every 4 persons, 3 people suffer of this sight infection. And so one of the things that matters to me a lot is the fact that just because they can't afford glass to see. So what are you doing about that? Well, Taraba Television this morning and Franklin Live International, and of course Mama D, whom you've not seen in a while, will be here because she's touched by this infirmity alongside Dr. Angela, who is also an ophthalmologist. So in the second part of the show, Mama D will be here on the platform to expatiate on that. But to discuss this health issue and other related matters to health is a professional in the health industry who has put in several decades of professional service to the industry of health. And he is the Secretary General of the Christian Health Association of Nigeria, CHAN, and also doubling as the Coordinator West Africa of Africa Christian Health Platform. It's good to have Mr. Michael Ida in the studio. It's good to have you, sir.
Thank you very much.
And welcome to Taraba Television.
Thank you very much. It's nice to be here.
How do you find Taraba State?
The last time I was in Taraba was about 15-20 years ago. And coming in last night, I'm driving through Taraba. I see tremendous efforts going on to change the landscape and infrastructural look of the state. And I think there's a lot of work going on by the government in this state. Interestingly,
the sobriquet of Taraba is nature's gift to the nation. Did you feel that nature's gift when you came into Taraba?
If you give me a few more hours, I think I'll feel it. Over the night, it's too early to discuss that.
Okay. Our motto by the governor of the state is give me peace and I will give you development. And you know, the northeast region of Nigeria is known to be very, very engaged in crisis sometimes. You had the courage to come to Jalingo. What motivates you? Your work?
Well, first of all, as far as there are human beings that are affected by health issues, we will always find a way of serving them. And as a Christian organization, we are trained to go into very hard to reach areas, irrespective of the situation. But for Taraba, I think even in the northeast, with all the crises happening, I don't know the secret, but there have been some level of peace and control of government in terms of security in the state, save for the few communal clashes on land here and there, but majorly like what we find in the other parts of Northeast. I think Taraba is relatively very peaceful and some of us are not afraid to come in.
Good. The Christian Health Association of Nigeria, which you lead, has a motto, reaching the unreached. What is CHAN all about?
About over 40 years ago, um, various church denominations, through the missionaries, were providing various health services. And it came to a point in 1973 that three major blocks came together and said, okay, how can we coordinate the work of the church denominations in the area of healthcare provision? So the Christian Council of Nigeria as a block, the Catholic Bishops' Conference, and the Northern Christian Medical Advisory Committee came together to establish CHAN. And then CHAN got registered in 1978. Today, by the records, there are over 600 health facilities of the various church denominations in Nigeria, cutting across teaching hospitals, tertiary institutions, secondary health facilities, and over 300 primary healthcare facilities. And so CHAN is just a coordination body, and all these other health institutions or facilities are members. And so what we do basically is to coordinate. And the interest of CHAN basically is on diseases that are of public health interest. Diseases like HIV and AIDS, malaria, tuberculosis, leprosy, recently COVID-19, and of course maternal, child and neonatal health care. And we are also promoting what we call disability inclusion in healthcare services. And CHAN also invests in capacity building. Capacity building, that means training of healthcare workers or professionals to update knowledge and skills in providing efficient and quality healthcare services. CHAN is structured into 4 zones. What we do is the country is divided into 4 zones. We have zones A, B, and C, C and D. And in each of these zones, we have what we call a zonal chairman. And then at the state, we have CHAN member institution committees. And then we also have a zonal coordinator. And so these people work at the grassroots and report to the headquarters where we sit. And then we are like a linkage to donors and funders of various health programs, and help to interface with the federal government and state government through the ministries of health. That's what we basically do. And for this coordination, why I'm in Taraba now is because since I assumed this responsibility, there's a need to meet with the CHAN member institutions in the states. And so that's why we have come to meet with them and to dialogue and see how we can increase the collaboration and provide better services to Nigerians, especially in Taraba State.
You made mention of CHAN as an organization overseeing well over 600 facilities across Nigeria.
Yeah.
Wow, that's quite big. Where are these facilities located? Are they located in urban areas or also in the remote areas and hard-to-reach areas of our societies?
These facilities are located in both regions, both urban and in rural areas, and in very difficult terrains. Sometimes you find it interesting that in a place like Adamawa, we're in the Koma Hills. There are places you cannot drive a vehicle there, so sometimes we resort to even using bicycles or motorcycles to reach those areas. So we have facilities in most of the facilities are in rural areas, which are primary healthcare facilities, and a few also in urban and semi-urban areas.
Now, you are a Christian organization that is engaged in providing quality health services to the people of Nigeria, cutting across interreligious, political backgrounds and all that. Is there any collaboration between CHAN and the government with the activities you carry?
Of course there is. Every service provider must engage with the government. The government is the sole owner of all the services relevant to Nigerians. And so what we are doing as CHAN is basically to complement the efforts of government. So there is a government relationship, and we report to the government. All our reports are fed into the government plans, and we also implement based on the government or national plans for health. We cannot bring any initiative that does not conform with what the state or the federal government plans. For instance, in Taraba, if there is a health policy on ground, we cannot come with a different system of approach that does not conform with the state health plans. So we work very collaboratively with the government, and we have platforms where we engage and plan on health issues at the national level. And in the states, we encourage our members, and that's one of the things we'll be talking about today, that facilities in the state should work in close collaboration with the government. The government is the owner of all the services. Us is just complementary. And so as a complementary partner, we must respect each other's mutual interest. So even though we're a church, we are not limited to just serving only Christians. Our services cut across, irrespective of religion, ethnicity, creed, age. We serve every human being as far as you have a health need, because it is everybody's right to attain quality health care.
Okay, thank you very much. You're providing health services to Nigerians, and this has been accounted for the past 40 years and above. Now, I understand that you've been presenting before the National Assembly, the State Houses of Assembly, a proposal for the legislative arm to vote into law or pass into law a support system that will also assist missionary health institutions. At what level are you right now?
Thanks for bringing that up. This is one of the big challenges we're having now as Christian institutions, both at the national and the state levels, and even at the local governments. The point here is that there have been a lot of economic decline, which has affected service delivery across board. And for us as church institutions, it's even worse, because if you see the enormous resources that are in the hands of government, and both human resources and financial and even material, the point we advocate for here is a closer collaboration where out of the annual budget of the government, a percentage be allocated to support the mission health institutions to be able to get drugs, quality drugs, provide efficient services. Even posting of personnel is quite a great support.
To support the facilities?
The facilities,
okay.
Individual
okay.
facilities with those relevant different capacities, because all the capacities of the facilities are not on the same level. And so those are the things. And so to make it statutory as a practice is the initiative to pay an advocacy towards requesting the government to allocate a certain percentage to the services of the churches.
Okay. Well,
but then you ask, where are we? We're still in discussion. Few states have done the public hearings, but other states were still negotiating. Like in Taraba, because of changes in government, we are still negotiating and discussing, and we hope that the members here will be able to approach the House Committee on Health and begin and continue the discussions from there. And we look forward that Taraba, being a friendly government, will give us a listening ear.
Oh, amen to that, amen to that. And then finally, before you go, following the outbreak of the coronavirus, I know it will be a worry for the Christian Health Association of Nigeria, especially for the communities in remote areas. Has there been any approach towards that, and what exactly is the organization doing?
Yeah, coronavirus has caused a lot of fear in the lives of everyone globally, and in Nigeria it has also been a scare. As at yesterday, we have reached the 60,000 confirmed cases. As CHAN, what we did was to discuss with some of our partners to support CHAN through COVID-19 related items for personal protection of health workers who are the frontliners, and also to help control and prevent infections. So we got some of those items and have shared among some facilities, with some facilities in the state too. Taraba has benefited. But we're still on, and we're also supporting government with all the right messages on taking the precautionary measures of ensuring you wear face masks, keeping social distances, hand washing or use of sanitizers. And if you, anything at all, if it's not absolutely necessary, stay indoors. So we are also in the efforts of providing those equipments to combat the pandemic in Nigeria, and we give God the glory that a lot is going on. And we have had, like on Friday, tomorrow, we are expecting another shipment of COVID-related items as oxygen concentrators and ventilators, which again will be shared among some of our health facilities. Those are some of the efforts we are making.
Okay, and some of these donations also, will they get to Taraba State?
Absolutely.
Okay,
Taraba
good.
is a major stakeholder
Beautiful.
with CHAN, so
Beautiful.
some of the facilities here will definitely benefit by
Beautiful.
this.
Okay. Thank you very much, Mr. Michael Ida, Secretary General of CHAN, and also the coordinator at CHAP West Africa. It's good to have you on the program, and good luck in your humanitarian services through health.
Thank you very much.
Thank you so much. Well, thank you very much. It's been the Secretary General of the Christian Health Association of Nigeria, Mr. Michael Ida, who is on a monitoring and evaluation visit of the activities of the Christian Health Association of Nigeria in Taraba State. And of course, you will agree with me that we have a multitude of missionary health institutions across Nigeria owned by some of these churches, and both Christians and Muslims access these health services by this NGO. Well, Franklin Live will continue in a moment, but it will be Mama D on this platform with Dr. Angela, a renowned ophthalmologist, who will be discussing about the World Sight Day. So stick around and behold Mama D and Dr. Angela. See you.
Napesi on the mukte mananga.